Everyone, I am Shruti Sharma and welcome to my channel. Today we are going to learn about the difference between osteoporosis, osteopetrosis and osteomalacia. Let's wordplay. What is porosis? Porosis means something that is porous. Petrosis, it means stone-like or which is something that is dense. Malacia, it means something that is soft. Osteoporosis is loss of bone mass. Osteopetrosis is the failure of normal bone resorption which leads to thickening of the bones. Osteomalacia, it is the defective mineralization of osteoid, or in children, cartilaginous growth plates are defectively mineralized, which is called rickets. Let's start first with osteoporosis. What are the causes? Here, the bone resorption is increased due to increased activity of osteoclast or its activity. The number are increased or the activity of osteoclast is increased. Also may be due to the decreased estrogen, old age, by cigarette smoking, or it is secondary to drugs like steroids, alcohol use, anticoagulant drugs, or thyroid replacement therapy drugs. How can we diagnose it? We can diagnose it by DEXA, which is bone mineral density measuring device or diagnosis method. How can we prevent it? We can prevent it by regular weight bearing exercise, adequate intake of calcium, vitamin D throughout adulthood. How can we treat it? By drugs like bisphosphonate, teriparatide, SERMs, denosumab, romosumab. It can lead to mild compression fractures and kyphosis. See here in the diagram, I have shown the picture of a vertebral column. You can see the black area. Here it means the bone is porous or the bone is absent. Black means air and white means bone or something that is solid. White means bone, okay? I have also shown the diagram. The normal vertebra, the vertebral column is not misplaced. Here in the osteoporosis, you can see because of the porosity of the vertebral bones, there is invasion of intervertebral disc, which leads to constriction of foramen. So there can be compression of nerves, which can lead to further defectiveness and deformities in the body. Now let's move to osteopetrosis. It is the failure of normal bone resorption which leads to thickness of bones. It is maybe due to defective osteoclast mutation in carbonic anhydrase 2 or its deficiency. Actually, what does carbonic anhydrase do? It balances acid and base in the body. Actually, osteoclasts need H positive ion to dissolve the bone, but due to carbonic anhydrase 2 mutation, it cannot do that. So, what can osteopetrosis lead to? Pancytopenia, extramedullary hematopoiesis, nerve impingement due to narrowing of foramens. In the X-ray, there will be symmetric sclerosis, which is also known as stone bone. How can we treat it? It can be treated with bone marrow transplant, because osteoclasts are derived from monocytes. I have also shown the picture. You can see the thickness of the hip bone. It's very dense. Now, let's move further to osteomalacia. Osteomalacia is defective mineralization of bone or cartilage. Causes are vitamin D deficiency, On the X-ray, there will be osteopenia, pseudofractures in osteomalacia. What is pseudofractures? Actually, there will not be any breakage but bending of bones. That is called pseudofractures. There will be epiphyseal widening and metaphyseal cupping, fraying in rickets. Cupping is nothing, it's just like the normal, this is the normal bone. The bone that is affected will show a cup-like depression. What is fraying? Fraying is nothing, just the borders will look irregular. Also, in children with rickets, there will be bow legs, which is called genu varum. Also, there will be bead-like costochondral junctions, which is called rachitic rosary. To understand it better, I have shown the picture below. Rachitic rosary, as you can see, the bead-like structure of the costochondral junctions. This is a very important finding, rachitic rosary. Next, there will be craniotapes, which is softening of skull bones. The biochemical findings will be decreased level of vitamin D, decreased level of serum calcium levels, and increased level of parathyroid secretion, and there will be decreased level of phosphatines. Also, there will be hyperactivity of osteoblasts, which leads to increased level of alkaline phosphatase enzyme in the serum. Thank you so much.